everybody, we're back. My name's Elisa. We're going through the endocrine system and it's part 7. Let's talk about the thyroid and the parathyroid, which are some of my favorite glands. So, it's the largest gland, the thyroid is, that is purely endocrine. It's composed of two lobes and it sits right at the bottom of your voice box. Should you decide to have a dissection, it would be dark reddish brown due to the fact that it is really soaked with blood, right? And the reason is because it's secreting lots into the blood and it's monitoring a lot of different elements that are in the blood. So there are thyroid follicles, and what these are little sacs that are made up, making up most of the thyroid gland itself. And so they have protein-rich colloid, follicular cells, and so those follicular cells are going to be big-time manufacturing cells, and they are simple cuboidal epithelium, and they're lining those follicles, and so they're going to be secreting directly into the blood. So generally, the thyroid gland. Well, let me make sure I didn't skip. No, we're good. We're good. Okay. Thyroid gland is going to secrete thyroxine, and so we refer to that as T4. And the reason it's T4 is because there's 4 iodine atoms. Well, they are items, right? Atoms. And trithyroidoxine, and so 3, so that would be the iodo refers to the iodine, right? So 3 tri-iodo, right? Thyroxine in response to thyroid stimulating hormone, TSH. And so that does things like it increases the metabolic rate, oxygen consumption for metabolism, body temperature, appetite, growth hormone secretion, alertness, reflex speed, also things like calcium absorption or metabolism, absolutely whole host of things. Parafollicular or clear cells actually secrete calcitonin, right? So this is going to be monitored with the rising blood calcium, right? Because you always need to have kind of a regular ambient amount circulating in the bloodstream. So it also stimulates osteoblasts, right? The cells that are going to be building osteo, which is bone, building bone, activity and formation in children. So here's the thyroid gland right here sitting around the voice box, right? It's highly dependent, as we talked about, on iodine. There was a time actually where goiter, which is when we'll look at this a little bit later in the class, but the thyroid gland will actually expand in response to there being not just enough iodine out there to complete its biological function. So it's kind of an interesting thing. Also, thyroid cancer is often detected just visually by looking at an individual's neck, just right under the voice box. So just that's a common first indication to go and get checked. You see here we have superior and inferior arteries and veins, right? So they're coming in from both the head as well as the rest of the body. They're meeting there, they're exchanging lots and lots of blood flow. Oh, where it's connected in the center, isthmus, right? Yeah. Here's what it looks like on inside. So I talked about things like the little cuboidal cells, like the simple layer, which means like one cell thick. So here's an example of that. So each one of these is a follicle, all together, and then they're made up or lined by the follicular cells, the parafollicular cells supportive right there, also known as the clear or C cells. And so inside, what you would be looking at, that pink mass of what they are secreting, is going to be thyroid globulin. Okay, so this is kind of interesting. So there's these other things called the parathyroid glands. I shouldn't say that. There are these other organs that are called the parathyroid glands. There we go. And interestingly enough, they can be found kind of in a lot of places in the upper body, uh, thoracic and cervical region, but generally you're going to find them embedded, at least 4 of them in the posterior surface of the thyroid gland. So it's like a gland within a gland, but it's not the same gland. So they can be found anywhere up to the hyoid bone, again, which is over by the voice box part of it, to as low as the aortic arch, down in the chest. So they secrete parathyroid hormone, so PTH, and again, that's increasing the blood calcium levels, right? It does so by promoting the synthesis of calcitrol, but that means that it stimulates the osteoclasts to start tearing apart the bone matrix itself and extracting the calcium from your bones and resulting in things like possibly, if overused, osteoporosis or weakened bones. So that's just something to think about. It also decreases the excretion of urine. Um, right. I think there it is. Okay. So if you could imagine, this is just imagine up here the pharynx, right? That's the posterior view. So there would be the voice box kind of in front, right? And here's the thyroid gland wrapping around to the posterior. And so those like four little yellow bits, those are the parathyroid glands proper. And so if you look up a little more closely, you can see it's definitely a different tissue. Whereas for the thyroid, we had these follicles, right? So they were these big pink blobs of secretion, and they were surrounded by a single, simple cuboidal cell mass. This is going to, or layer, I should say, cell layer. Uh, this is the parathyroid gland where it's a lot more dense, and there isn't really kind of these holding chambers, and you can see it butting up actually right next to the thyroid gland, and you can see these like little follicles kind of having their discrete singular layer, right? So there's that. Oh, I think that's probably it for now. Okay, so I hope that was helpful, and I hope you're somewhere out there having a wonderful day. Bye-bye.